What are the different avenues that funding comes from?
For most people, they're getting funding from a large entity like the government. So those are probably the biggest sources of clinical funding and laboratory funding. For someone in an academic center like myself, probably the biggest source is the government. After the government comes, I would say, private donation groups like, I don't want to, isolate specific ones, but enter whatever research organization. There's usually things that'll rally around a lung cancer or prostate cancer or whatever. They do their 5K, they raise their money, and then what they actually do is they set up information on their webpage and they put out things to researchers to say, hey, we want to fund something in the breast cancer space, targeting, in this case, maybe still HER2, and give us your best idea on how to do that within these parameters. And we'll give you 250,000 over 2 years. So that would be another example of something that's very, very common. Beyond that, you can have partnerships with pharma. Those can be very helpful because the pharmaceutical company, maybe they make a drug and they want to use someone else's models that they don't have to prove that the drug works and to investigate it further. So they'll pay a lab to work together. And then the lab publishes the paper together. And that's usually actually a pretty good example of pharmaceutical companies working well with academics. I would say those are probably the major ones. But again, the biggest one is going to be the government. And this is what you talk about, or you hear with NIH funding. Department of Defense actually pays quite a bit. So through different avenues, the government pays for a lot of the academic cancer research funding. And that's why a lot of us feel threatened when there's variability in how the government does that.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit krakencancer.org to join the Kraken Cancer community.